bit about myself. I grew up in Canada. I moved to Arizona in high school, so I've been in America for a long time. My dad owned a California closet company, franchise up in Canada, and when he sold it, he got out of the closet business and decided that's what he did. So he ended up opening up his own business, and that's what I did growing up. So I was always into carpentry and stuff like that. But I knew I was more into like artsy-fartsy stuff, like dentistry. And I knew I had the ability to help people out. So I eventually talked to a bunch of different medical providers, and growing up I knew a lot of dentists. And so that's the field that I decided to get into. So I ended up going to the University of Pacific in San Francisco, graduated in 2008, practiced in Arizona for a couple of years, and then I moved to Colorado Springs after I bought into a partnership and had some great partners out there. I ended up taking a dentist spa course and learned how to do Botox and dermal fillers and loved it. And I was the only one in my office that was into that. So they basically would give me all the patients that were interested in those types of procedures. Well, fast forward, I knew after doing a few years of just Botox and fillers that there were many gaps in what you could accomplish with those procedures. So I went to the IFA symposium in Miami, and that's where I met Sally. It's a common theme. If you've been listening, Sally has connections. She's like the mafia. So anyways, I dumped my life story onto Sally. At the time, I was going through a divorce, and so fast forward, we're now married, and we have 8 beautiful children together. So we are busy, to say the least. And we also have a farm with pigs, chickens, goat, which she texted me while I was at the office and was like, I need you to help me castrate this goat. I'm like, okay. We're talking about some weird things right now. So yeah, she helped. I had to pin this goat down while she did the deed. Yeah. I was glad that it was her, not me. I just had to not get poked in the eye by the horns of the goat. So anyways, so we've been talking kind of globally about what some of these energy-based devices can do, right? However, radio frequency, has been used in medicine for a long time, like 30 years. And when we are in the office, I think, me personally, I usually have maybe one patient a day that complains about TMJ issues. And I think statistically 1 in 10 patients out there have some type of issue, right? So it's common. And I think we all have had that experience where we go through kind of the list of possibilities. You know, we talk usually about splints or night guards, and they're like, I'm not going to wear that. Or you can talk to them about Botox, and they're like, I'm not putting poison in my body, right? So there's a lot of rejection or resistance to certain modalities that are out there. And one of the beautiful things about radio frequency is that it's an immediate treatment that you can provide. You know, normally when I had a patient that had an acute issue, I was basically could talk to them about maybe getting them some pain relievers or muscle relaxers, right? So that's not a great way to treat them. So the beauty of using radio frequency is that you have this ability to treat them then and there. And they don't have to wait for the Botox to kick in. They don't have to wait for the night guard to be fabricated, right? So that's been a big changer for us in our practice. And really, my conversation with patients is very simple. I just talk to them a little bit about radio frequency. I just say, look, it's just energy that we're injecting into your tissues, and that's going to create some heat. And really all that's happening when you get heat in the tissues is you're going to have an increased amount of vascularity. It's going to help them become more elastic, and the metabolism of that area is going to increase. And we're going to be able to, with the vacuum component of the V form, it's actually going to help to massage the lymphatic and get some drainage of some of the byproducts that are in the muscle causing problems, right? So just go through that with them. And like I was saying before, RF, or radio frequency, has been used in medicine for a long time. And the ablative procedure, which is a lot like a laser or an electrosurge, has been used for a long time to ablate tissues. Monopolar was the original way, and then Viora came along and really revolutionized the way that radio frequency has been performed. But basically there was a grounding pad under the patient, and there was a monopolar radio frequency node that would inject the energy into the patient and just shoot it like a shotgun throughout their whole body, right? So it wasn't very safe, and there were a lot of issues that would come with that. And then they eventually started to learn that they could do pulsed RF, which was a little bit more controlled and a little more safe. So there was an evolution of radio frequency over the years. And really, heat for pain is a thermotherapy, right? So anybody that's played sports, Shaq advertises icy hot. You've got your heating pads, your different things to warm up so that your muscles and joints start to feel better, right? And that's essentially what we're doing. It's a physical therapy approach of how we can treat the masticatory muscles and the joint space. And really, heat's reassuring, and that in and of itself is an analgesic. One of the beautiful things about radio frequency is that they've got the FDA indication, right? So Viora and Sinclair now has always been an aesthetically driven company, but they knew that there were therapeutic indications, and that's where the study came into play. And so basically what we would do is when we would have our patients come in that had complaints of TMJ or TMD, is we would ask them to rate their pain on a scale of 1 to 10, 10 being the worst, and then we would also measure their interincisal opening. And every time we treated a patient, there was improvement on the pain scale, and then they would also have improvement on their mobility of their jaw. So it was really a fantastic treatment that really opened my eyes to this awesome capability that was there for us to use. When we acquired the device, when the Viora came in and trained, Denise was the trainer at the time. And of course, us as dentists, we've always got back issues and things, and my partner at the time had just like really bad back pain. And so Denise was like, here, let me do this on your back. And my partner was blown away by how much better he felt after some radio frequency on his back. So I was like, oh, there is something to this. So yeah, now that we've gotten into or away from monopolar radio frequency, their core, which stands for channeling optimized radio frequency energy, basically what it does is it takes the energy from one node and passes it through the tissue to the other. So it's much more controlled, have much more ability to put the energy where we want it specifically, right? And by changing the hertz, it changes the depth of penetration, okay? So Dr. Vane talked about the VST, which is the smaller handpiece that's just got the 2 nodes. And then there's the other one, the V form. We'll get into that a little bit later. So the VST, typically you're going to use that in the temporalis area or the frontalis area to treat those areas, because the skin's very thin there, and that will help you to apply radiofrequency to the muscles there. And as you can see, there's the different modes in radiofrequency, right? So mode 1 is going to get you your deepest depth of penetration. And that's, for those that do Botox, when we're using the needles, we're typically doing anywhere from 4 millimeters to 8 millimeters of penetration so that we're getting into the muscle, right? So as you can see, you're able to get about 7.2 millimeters in mode 1. So you're able to get pretty deep. Now when we go to the V form, when we assist it with a vacuum, there's actually more nodes, and between that and the vacuum component, we're able to get even better depth of penetration. So like in the masseter area, in the medial pterygoids on the neck, we've got the sternocleidomastoid, the trapezius, and we're able to get a little deeper penetration there. Now, the vacuum, we don't recommend going above 2, just because the skin on the face is a little thinner and we don't want to cause any hickeys, right? Petechia. The beauty of that is you can actually put that right over the joint space and treat the retrodiscal tissue as well. And that tends to be where a lot of the inflammation and pain comes from, in the joint space. All right, so I don't know if you can see this very well, but the V form, we're typically going to have it in, usually what I like to do is there's 4 different modes, right? So there's 1, 2, 3, and 4. When you do 4, mode 4 basically delivers 1/3 of the energy to each of those kind of layers. So what I like to do is to pre-treat or preheat the area just to minimize the discomfort for when you're going to mode 1. And really, it's a very comfortable and soothing procedure. The only real risk of any type of discomfort would be from you incorrectly applying the nodes to the surface of the skin. So as long as you're careful and you're getting good contact with those nodes, the energy will safely pass through the tissues and get to where it needs to be, instead of jumping across the surface of the skin and causing an arc burn, is what they call it. And then the VST, what we'll typically do is 6 passes over the frontalis and temporalis if we need to do that. Okay, and we've found that that's generally going to give you about 3 to 4 days of relief. As we all know, there's a variety of different issues when it comes to TMD, whether it's the joint that's the issue or the muscles of mastication. The beauty of this is I found that when it's an acute issue, it works really, really well, and sometimes all it takes is 1, maybe 2 treatments, and then that gets the patient on track. When you have a patient that's been dealing with a chronic issue for 20 years, it's usually a bigger or uphill battle. And usually my conversation with the patient is typically trying to give them what the real expectation of what the radiofrequency can do for them. The other benefit to treating the muscles of mastication, and I've had to use this a few times in the office when I'm doing molar on second endos, or second molar endos, is you need to have some space to get in there, right? And sometimes when you ask a patient open as wide as they can and you can barely fit a fork in there, it's going to be hard to get a file in there, right? So we do have a code that we recommend that you can use in dentistry, and it's D7899. It's unspecified TMD therapy. And so I've been using that for years. So that's something I think is something to jot down. I don't ever use the medical codes, but if you're into doing medical billing, there's that as well. The cost of treatment, I kind of compare it to a massage, right? If you go to see any masseuse, typically for an hour, they're going to charge you about $70 to $100. And it really only takes you about 10 minutes to perform this procedure, and it's delegatable, so my assistant can do it. Here's the white paper from the case study that we did. So the benefit really boils down to, this is something that you can do on the spot. So if someone comes in, they haven't been able to sleep that night, they woke up with jaw pain that they normally don't have, this is where it really shines. This is where it really helps you to be the hero. This is one of my favorite things to kind of introduce my patients to. I call them R2D2. When I roll in V20, they're like, what is that? And I can kind of talk to them a little bit more about the aesthetic side of things too. So it's always a good introduction. The beauty of it too is every time that I've performed the procedure, we've always had pain relief. And I think that's phenomenal. The ability to reduce their pain is just great. And really, the nice thing about this procedure is it is comfortable while you're doing it. It's not uncomfortable, it's actually very soothing, and it's a lot like a massage. And the nice thing about the V20 is you're also able to offer all these other treatment capabilities. You know, the refit, the relift, being able to address submental fullness, the jowls. So there's so many things that you can do with these hand pieces. This is just kind of showcasing some of the things that can be done with the VST handpiece, so the bipolar radio frequency over there. You can see the difference in the wrinkles from just one treatment on that patient. You can see how much it's addressed the laxity and the fullness of the jowls. You can use it for under-eye treatments, help to address some of the bags under the eyes. Like Dr. Myron is saying, I really dislike treating under the eyes with fillers because it's so easy to bruise. And that's why the VST is so nice for under the eyes. Once again, some submental fullness, the double chin. And you can see how that really helps to contour underneath the neck. Some more relift cases. And then once again, a younger patient was able to get a little better submental area. I was